it's virtually impossible to fail to diagnose a heart attack today if one has a reasonable index of suspicion that a patient is suffering a heart attack. They usually involve chest pain, maybe with excessive sweating, which is called diaphoresis, maybe with chest pain that radiates particularly to the left arm. If you have any of those symptoms, you should immediately consult a healthcare provider. Because again, all it takes to diagnose a heart attack is a simple blood test to show whether you have any heart muscle enzymes in your blood that would go along with death of myocardial or heart muscle cells. So again, you want to diagnose a heart attack as early as possible. You want to get the patient potentially on some blood thinning agents as soon as possible. And early initiation of drugs, so-called clot busters, may halt a heart attack in its tracks and allow the heart to be reperfused, minimizing damage to the heart muscle, and perhaps leaving the patient with really minimal adverse sequelae. These folks can usually resume a normal lifespan. They may have to go on medication for heart disease, but even taking that medication, they can still lead a very good life. In regard to heart disease, we talk a lot about angina, which is basically just chest pain that occurs usually due to a decrease in blood flow to the heart muscle. These patients have chest pain. Again, they may have profuse sweating. They may have pain that radiates into the left arm. They may grasp their chest. These are symptoms that must be evaluated by a healthcare professional, perhaps early on with blood work, simply to be sure that the patient's not had a heart attack. There may be a place for echocardiography to determine if the heart is beating and pumping properly. There may be a place for cardiac catheterization where intravenous contrast is actually injected into the coronary arteries to be sure that the heart is getting enough blood. Remember, a heart attack is solely due to the heart not getting enough blood. Multiple interventions, angioplasty, placement of a stent, in some cases coronary artery bypass grafting, are all effective at treating heart disease. So again, the real issue here in timely diagnosis is that yes, there's very effective treatment available if you're diagnosed early. So don't take it for granted. Have these studies done. See your healthcare professional again. Allow him or her to sort through the various diagnoses and then receive effective treatment.